Good afternoon, and thank you everyone for attending today's webinar, New Jersey Medicare Advantage Market Disruptions, presented by Robert Frank of Absolute Insurance Management. Please be aware that there will be a question and answer portion today at the end of the webinar. To avoid frequent interruptions during the webinar, please type your questions in the question box located to the right of your screen. They will be answered in the order received during the question and answer portion. Additionally, an electronic version of this presentation will be emailed to all participants following completion of today's webinar, and a recorded version will be available on the website for members only. Again, New Jersey MGMA would like to thank you for attending, and I will now turn things over to Robert.
Thank you, Alex, and thank you, Dawn, and thank you everyone that's on the call. I just wanted to get everybody together to talk about what's happening in New Jersey. Information that just went public as of October 1st that's going to affect your practices. Just to tell you a little bit about myself and where I come from, I have worked in the managed care industry. As you can see up here on the screen, I've worked for some of the major carriers at pretty high level. I've been on a mission the last couple of years to really put the power back into the doctors' hands and the hospitals, but more importantly too, putting the patient first. We're going through right now a paradigm shift in healthcare where everything is moving from fee-for-service to value-based care, and we've really stepped up our efforts to be there and be a partner with the physicians and help them focus on, medication adherence, which is a $300 billion problem in the United States, population health, patient engagement, and other things, and helping those with multiple chronic conditions. As you know, physicians cannot recommend any one insurance company. What they can do is they can work with an independent advisor or subject matter expert that is unbiased and basically will look out for their patients and what's right for them based on their needs and their wants. So we're going to talk today about the Medicare Advantage plans that are going to be terminating, some patient assistance programs where your patients can get free medicines or low cost directly from the drug companies, something that is very underutilized in the state of New Jersey, the criteria for that, and ways that you can compliantly protect your practice and hit your metrics, because we know you're all rated and engaged now on certain criteria, which affects your wallet or your purse. And we're going to talk a little bit about diabetes and how much of an epidemic that is and how we can help get your diabetics help. You'll see on the screen above here, this is the letter that came from AmeriHealth. This is the one that's going out to your patients. Those are the ones that are going to be affected the most in the state of New Jersey. We'll talk about it in a minute, but there's a little over almost 19,000 of your patients are going to be dropped in New Jersey, and they received a letter just this past weekend. And as you'll see on here, the letter went out on September 28th. Many of the folks are receiving the letter now, and your phones are probably starting to ring now saying, what do I do? And they're in a panic. So basically, these plans will terminate on December 31st, but they actually have until February 28th to switch to a new plan. So the companies that will be terminating in New Jersey, the AmeriHealth 65 preferred HMO, approximately 18,735 members. That's statewide. The Geisinger Gold, they have an HMO and a PPO, approximately 5,930 patients, and they are only in Monmouth and Ocean County. And then Aetna, just the value plan. It's approximately 4,500 patients. So collectively, close to 30,000 people are being affected in the state of New Jersey. What I've done is I've taken the top 6 counties. You'll see that with AmeriHealth, there's patients that are being dropped in every county. But I've only listed the top 6, and I can make available all the other information as well. So you'll see here in Camden, AmeriHealth is dropping 5,733 patients. The Aetna plan, they'll be dropping 2,480, and then the AmeriHealth with no RX, 202. So for a total of 8,415 patients just in that one county alone. I also have on there the number of seniors in that county, how many have a Medicare Advantage plan, and the penetration and the average, the income, which when we'll talk in a few minutes about how they can get help with prescription drugs, and it's highly underutilized in the state of New Jersey. You'll see in Burlington County as well, 5,252 folks that are going to be receiving a letter that their coverage is now terminating. Income a little bit higher there, 36,101 on average. Then we get into Gloucester, another county that's getting hit pretty hard. 4,124 patients will be affected. Once again, the majority of them being with AmeriHealth. Cumberland, 1,299. Then we get into Monmouth and Ocean. This is where Geisinger really, well, this is the two counties that Geisinger is in right now. But you also have some folks that are losing coverage with AmeriHealth and Aetna. You'll see Monmouth County, 3,517 patients, and in Ocean County, 3,881. Here's something even the media, a lot of folks out there do not know, and this is serious. Everybody thinks that with Obamacare or the accountable care that pre-existing conditions went away for all. That is not true. If you are working and you are still on Medicare, then you're covered under the Affordable Care Act. But if you're on your own and you have a Medicare supplement plan and you want to switch from one to the other, insurance companies can deny you based on pre-existing conditions. That is something we deal with every day, and that is something that it's sad that this is even occurring in America, because we all thought that everybody was going to be covered and there was no more pre-X. Well, that's not the case. So that's why we need to be proactive, and I'll get into that in a minute. Being proactive versus reactive. I don't need to tell you, but the revenue cycle is under attack with all these new laws and regulations. I come from a managed care background. A lot of the things that are being instituted now are managed care techniques or type of programs. The guy that currently is running CMS, the acting administrator, his name is Andy Slavitt. He comes from United Health Group, a managed care company. And as you know, Optum is a $140 billion company. So he's the one at the helm right now running Medicare. So some of these things that are happening now, bundled payments, you know, with the institution of MACRA, exits from ACA insurers. We now only have 2 carriers in the state of New Jersey, 2 Obamacare carriers. You have Horizon and AmeriHealth. The others have exited. So that is something that the physicians are dealing with as well, with patients that are getting dropped. Then you get into the issue of, am I a tier 1 or am I a tier 2 doctor? Am I going to lose that patient now because I'm a tier 2? A lot of things happening all at once. Now that patients will be terminated from their insurance plan, it's imperative that they understand now they're going to get a piece of paper. So by them, these insurance companies dropping out of the state, that piece of paper is guaranteeing them coverage with no pre-X. I call it a gift from God, because now somebody can take that piece of paper and they can get any plan that they want. They can get a Medicare supplement plan with no issues, no questions, no medical underwriting. We had a similar situation a couple of years ago where we had about 100,000 folks dropped in the state of New Jersey, and there was a lot of people, a lot of your patients that missed their opportunity. Reason being is because when it comes time for the Medicare season, the annual enrollment period, they get inundated with all kinds of clutter and junk, and they don't know what is real and what is legit. What should I read? What should I throw out? So a lot of it just goes in a pile, and then it gets thrown out. Problem with that is the letters of termination are included in a lot of times in that pile that gets thrown out. So they don't even know that their insurance has been terminated, and you know that because they show up at the office, and you go to put in file something, and then it gets denied because they don't have coverage. but there is help available. So we're taking this situation, and as we've done in the past, and we've taken the negative and we turned it into a positive, to then sit with the patient and let them know about what's available to them, how they can get medicines through PAD or Senior Gold from the state, how they can get them free from the drug companies. And we'll move on here. Oops. We talked earlier about the paradigm shift, moving from fee-for-service to value-based care. It's being mandated, or else you suffer a negative revenue cycle. And millions of dollars are being spent right now, but nobody is working together. Nobody is collaborating as one. And one thing that's not being done is they're not including mental health and behavioral health. There is a few projects in New Jersey, like with the Camden Coalition, where they're including Medicaid, but there is nothing with Medicare where everybody is collaborating, working together to try to help folks. We're going to get into now, we're going to talk about patient assistance programs. AstraZeneca has a patient assistance program, and this is one that we help people with probably daily. This is an article that they put out bragging about what they've done, and this is a good thing. The problem is a lot of people don't know about it here in Jersey. But in 2013, AstraZeneca gave away almost $1 billion in medicine to 567,000 patients. The income requirements are if you're under $35,000 as a single or $48,000 as a couple, they will send you their medicines free of charge. Medicines like Crestor, Atacand, Toprol, Nexium, Pulmicort. It's a simple application. It takes 2 weeks to go through. The medicine shows up at their doorstep unless it's something that's regulated where it needs to go to the doctor's office, and then they would get it from there. There's many patient assistance programs like this one with AstraZeneca, and some of them don't even ask income. There's no income requirements. So there seems to be a misnomer out there that if you're on Medicare that you cannot qualify or you cannot take advantage of one of these programs, and that is false. We're going to get into in the next slide, they're going to show you companies that work together with Medicare and ones that don't work together with Medicare. On the bottom, you'll see there the patient assistance programs. The cost of the medicines don't come off the money that's allocated for Medicare Part D. So this year, you get $3,310 before you hit the donut hole. Think of that as money in the bank. And how do they calculate that $3,310? They take the cost of the drug, let's say it's Crestor, and you have a prescription plan or it's through your medical and your copay is $40. But Crestor costs $270. They're going to take that full $270 off your $3,310. And then once that's depleted, then you go into that donut hole. For this year, or 2017, it's going up to $3,700. Now here's the beautiful part about it, the patient assistance programs, they don't interfere with Medicare Part D. They're two separate buckets. So that one drug, that Crestor, pretty much eats up your whole $3,310, and your patient would be in the donut hole. Well, guess what? Once they get a patient assistance program, they don't take off the $270. It doesn't come off the $3,310. You keep that money. That is huge. And now the practice has more samples to give to other people. Their patient is taking their medicine. We can even laser in and look at the metrics and see which specialties or which morbidities you're being tracked on. And we can look at those and see which medicines we can help your patients with so you can hit your bonuses and have better, and at the end of the day, have better patient outcomes, and that's really the goal here. So by saving the patient money, they have more money in their pocket to pay for other things like food, clothing, church, more money to put in the offering plate, go to the local diner. It just opens up, and you should see the smile on people's face when we help them with these programs. And we don't receive any funding, no grants. The way we win is we receive referrals from the physicians, and we help them by helping the patients. So that's how we win. You'll see on here, here's the breakdown of the AstraZeneca, the AZME program. Out of the 567,000 patients that got help in 2013, only 4,325 of them were in New Jersey. And I put a blurb on here, aren't we considered the pharmaceutical capital of the United States? And I asked physicians this when we sit down, and I said, why is this number so low? You know, what's going on here? And they say, we're inundated with all of these changes and paperwork. We don't have the time to do it. And they say, we really don't know enough about these programs. So I say, if we can take that off your plate and help your patients, it's a win-win for everyone. Look at some of these other states. You look at Texas, 86,328 patients got help. Yeah, North Carolina, 37,361. Ohio, 28,000. So what this tells me is people don't know about these programs. And prescriptions are going through the roof. Okay, here's a breakdown of the companies that offer help with patients that are on Part D, or ones that, the companies that don't help. So the first list here, you'll see patients cannot get help if they have Part D with those companies. The second column here, the one below, Medicare patients without a Part D plan may apply for these patient assistance programs. Go on to the next slide here. So you'll see on here more drug companies where you can get help. You'll see the first column there, the AstraZeneca, that's the one that I highlighted, the AZ&Me program. But this program's, you know, GlaxoSmithKline, once you've, you know, spent $600 in drug costs, now you can get their medicines sent to you. You know, you can get the inhalers. And the ones on the bottom there, there's certain medications you can get help with. And then there's some medications for MS that cost $3,000 a month, and there's no income requirements, and we've helped people with that. And it just, it's a good feeling, and it just, you know, people need help. I put a few slides in here just to talk about some of the different morbidities and things that are really putting a drain on the healthcare system and how people are really struggling. But diabetes, it's almost an epidemic. There's 79 million folks that are pre-diabetics. So by helping people get their medicines and stay educated and live a healthier life, we can help change these numbers. Here we're talking about integrating behavioral health and into primary care. And you'll see some of the studies here. The National Council on Aging did a study about the different states where people got help and where they're being successful with Medicare and the primary doctors. And nothing is happening here in New Jersey. The bottom story is talking about how they're helping with the Camden Coalition, what they're doing with Medicaid, but that is not Medicare. We are physicians, not providers. We want the best for our patients, and we will advocate a collaborative approach to help keep you healthy. Now we're going to so this is a hot topic, and this is something where what happens is usually the physician gets, and the practices are cleaning up the mess after the fact. And I said, we really need to be more proactive and be an advocate and get the word out. I would have liked to get the word out earlier, but I would have been breaking regulations with CMS and with the insurance carriers if I had disclosed this information out to you. So we had to wait until October 1st. So if there's any questions. Alex? Hello?
Okay, we have a question. If the plans are terminating on December 31st, what are they covered by until January 15th?
Okay. Once they're canceled December 31st, they'll have just original Medicare come January 1.
Okay. What carriers have resigned from the ACA program in New Jersey and when?
Okay. As far as the ACA program, today we're talking about Medicare, but the ACA programs are Health Republic, Oscar, and United, and Aetna. Aetna had a few members.
Okay. Are there any other questions? If you have any questions, you can type them in the question box. If not, then we'll be done for today. And the presentation will be emailed out to all attendees, and you can contact Robert for any further questions that you have.
You'll see on there, there's my contact information. We do have meeting sites and hotels set up strategically throughout the state where people are being affected. But once again, this is a one-on-one decision, and things should not be made based on what their neighbor likes, Aunt Sally, because we need to use Medicare.gov, and that dictates what we do. We also take in mind and we look at what plans the physician is affiliated with. That's important so you can protect the doctor's practice. We also look at all the different programs that are available, from PAD to Senior Gold, programs that help them get food. There's even a program where you can get your cat or dog neutered or spayed for $10 in the state. We know how folks like their animals, so thank you. I appreciate the time. Thank you to the MGMA, and I look forward to hearing from you and helping your patients and helping the doctor.
We have one more question. Is Aetna Better Health?
Yes.
Okay. All right. So if there's no more questions, then we will send out the presentation to all attendees. And thank you for attending.
Thank you very much.
Have a good day, everyone.